Today I'm going to talk a little bit about norovirus. We've recently seen an upswing in cases. It looks like there was a tour bus that went from Denver to Black Hills area, and as they went from the Black Hills area over towards Yellowstone Park, a number of those people who were on the bus started getting sick, and it carried with them all the way over to Yellowstone, and subsequently people that worked there as concessioners in the park started having nausea, vomiting, diarrhea, and low-grade fever. And we know that this is norovirus. It's really common in different outbreaks, and this time of the year we have a number of people who have been both in the hospital and down in Yellowstone Park who have norovirus. Typically what happens is you get exposed to very few viral particles. It only takes somewhere 20 to 100 particles, and you get sick with about 1 to 2 days later. You start having a lot of nausea, vomiting, diarrhea, and then it tends to run its course after a couple days, and then you get better. The biggest problem is usually just with dehydration, so you have to make sure that you get a lot of fluids just to keep up. It's one of those viruses that's very hardy, so it can stay on surfaces for a long time. And alcohol, like the alcohol foam that we use to clean our hands, doesn't work as well as soap and water. So the big thing for us in a hospital setting is to make sure we use soap and water to keep from spreading it. Typically, if somebody gets over it, they still shed for up to 21 days. Once you get better, we tend to keep people out of the hospital and have them stay at home for 3 days afterwards. When they're feeling fine, then they come back to work, and we make sure everybody's washing their hands pretty well.